తాగడం తగ్గించుకొని తగ్గించట్లేదు ఇవన్నీ అంటాం. బట్ వాట్ వీ డోంట్ అండర్స్టాండ్ ఈస్ ఇట్ ఈస్ వెరీ డిఫికల్ట్ టు హ్యావ్ అ టీ అడిక్షన్. సో cessation కానీ alcohol tea addiction కానీ they need help, they need professionals. Now we have programs, we have psychiatric interventions to prevent or to have this tea addiction. Most importantly, we should probe further and ask, are you finding it difficult? Recently I saw a patient, so they came for one of our cancer screening camps. Inside that facility, but the biggest fear in smoking is the constipation delivery. That is his fear. He knows all. He is knowledge. He knows that smoking causes enough, but he is unable to. So that is where he suggested it. No, on nicotine replacement therapy, there are drugs. So you can go it in a stepwise fashion. So we need to encourage them. Don't see them with judgmental eyes. Because మానేయడం చెప్పడం చాలా ఈజీ, కానీ మానేయడం యాక్చువల్లీ కష్టం. కాబట్టి we should be very positive and we suggest them that మనం ఎంత నెగిటివ్ వెళ్తే అంత నెగిటివ్ గా వెళ్ళాలి. సెకండ్ థింగ్ ఇస్ పర్సనల్ హైజీన్. సర్వైకల్ క్యాన్సర్ కి ఇప్పుడు మనకు వ్యాక్సిన్ ఉంది, బట్ ఈవెన్ బిఫోర్ దిస్ వ్యాక్సిన్ వెస్టర్న్ కంట్రీస్ లో సర్వైకల్ క్యాన్సర్ రేట్స్ అనేవి తగ్గాయి. ద రీజన్ ఈస్ గుడ్ పర్సనల్ హైజీన్, ఇమ్యునైజేషన్, ఎస్పెషల్లీ హెపటైటిస్ బి అండ్ హెపటైటిస్ సి వ్యాక్సినేషన్ చేసుకోవడం తోటి ఈ వైరస్ రిలేటెడ్ క్యాన్సర్స్, ఎస్పెషల్లీ లివర్ క్యాన్సర్స్ అనేది బాగా తగ్గుదల పడుతుంది. ఎయిర్ పొల్యూషన్. So air pollution is very, very important. If we see every year news we were reading that Delhi air pollution levels are very high in November, December, Diwali. If you see this year, we are listening the same thing about Mumbai, which we never heard in news. We are even hearing about Hyderabad. The same. The reason is pollution is on very high levels. Personal experience, 10 years ago, out of 10 lung cancer patients, 8 were smokers, 2 were non-smokers. Today, out of 10 lung cancer patients, 5 are smokers, 5 are non-smokers. అంటే non-smokers లో lung cancer పెరగడానికి కారణం biggest reason is regulation. So it is always better to have air purifiers, type-of-filtered air purifiers at home, especially if the particulate matter. ఇప్పుడు మనకి అడ్వాంటేజ్ ఏంటంటే మన ఫోన్ లో యాప్స్ తోటే మనకు తెలిసిపోతుంది ఎయిర్ క్వాలిటీ ఇండికేటర్ ఎంత ఉంటుంది. ఈవెన్ హ్యావ్ ఇట్ ఇన్ అవర్ కార్. కార్ లో మనం చూసుకోవచ్చు, రీసెంట్ న్యూయర్ మోడల్స్ ఆఫ్ కార్స్ దే హావ్ ఎన్ ఎయిర్ క్వాలిటీ ఇండికేటర్. అందులోనే చెప్తారు 100 కన్నా ఎక్కువ ఉందా, 200 కన్నా ఎక్కువ ఉందా, 300 కన్నా. Based on that, you know whether you are living in a polluted area using of air purifiers. That also helps. Third thing is treatment of pre-cancerous lesions. So regular screening, good health program ఉన్నప్పుడు pre-cancer అంటే క్యాన్సర్ కింద మారక ముందే మనకు కొన్ని లీజన్స్ కనిపిస్తాయి. ఎస్పెషల్లీ ఈ టొబాకో చూస్ చేసే వాళ్ళలో ఓరల్ క్యావిటీలో తెల్ల మచ్చలు కానీ ఎర్ర మచ్చలు కానీ, సో ఇది ముందుగా చూసి వాటిని ట్రీట్ చేసుకోవడం, వాటిని రిలీవ్ చేసుకోవడం. సో యూ ఆర్ ప్రివెంటింగ్ ఇట్ ఈవెన్ బిఫోర్ దే బికమ్ cancers. Third thing is legislation of tobacco, alcohol and air pollution. This is at a community level. So when you are promoting health as a forum of this thing, should also in your communities be active to promote, what are the steps the government, until and unless we ask for it, no political party or no government is going to do it for us. Until and unless. So what should we ask is about the control of tobacco, alcohol and air pollution. Otherwise, all the things which increase the air pollution, tobacco and alcohol gives good tax revenue to the government. So until and unless the people don't want it, the government is not going to regulate. Occupational exposure and also education. The most important is awareness. So once you are aware that all these signs ఇవన్నీ ఉంటే మనం ఇమీడియట్ గా డాక్టర్ దగ్గరికి వెళ్ళాలి, నిర్లక్ష్యం చేయడం, టెస్టులు చేయించుకోవాలి అనుకున్నప్పుడు నెక్స్ట్. సో సర్జరీ alone can cure cancer. సర్జరీ చేస్తేనే తగ్గిపోతుంది, సర్జరీ లేకపోతే it's almost most cancers cannot be cured. Again, it's a distance. Like I said, all the liquid malignancies, all the blood cancers can be cured only with drugs. There is no need for surgery. Certain solid tumors also they don't need. So even if surgery is needed, certain cancers, especially some types of sarcomas, breast cancer, colorectal. జబ్బు తిరిగి వచ్చే అవకాశం ఆల్మోస్ట్ 70-80% ఉండేది. ఇప్పుడు చాలా మటుకు అది 50%, 60%, 70%, 80% క్యూర్ విత్ న్యూయర్ థింగ్స్. సో సర్జరీ ఒక్కటే సరిపోదు. సో లాట్ ఆఫ్ పేషెంట్స్ డూ నీడ్ అడిషనల్. నెక్స్ట్, so chemotherapy cannot cure cancer. So chemotherapy is always painful, causes of lot of side effects. So the first thing is most people come to us is the fear of chemotherapy. I always say that జబ్బు అన్న ట్రీట్మెంట్ తోటి భయపడే, బట్ కీమోథెరపీ ఇస్ ఎ వెరీ బ్రాడ్. కూరగాయలు అన్నంత బ్రాడ్. కూరగాయలు ఎన్ని రకాలు ఉన్నాయి, కీమోథెరపీలో అన్ని రకాలు. సో అన్ని క్యాన్సర్స్ లో అన్ని మందులు వాడతారు. కొన్ని క్యాన్సర్స్ కి కొన్ని మందులు వాడతారు. ఆ కొన్ని మందులకి సంబంధించి కొన్ని సైడ్ ఎఫెక్ట్స్ కొంతమంది వస్తాయి. వాట్ ఈస్ ది న్యూయెస్ట్ బ్రేక్ ఇన్ హియర్ ఇస్ సపోర్టివ్ కేర్. అంటే కీమోథెరపీ సైడ్ ఎఫెక్ట్స్ ని ఫైట్ చేయడానికి మనకి బెటర్ డ్రగ్స్ వచ్చాయి. వి నో హౌ టు కంట్రోల్ దెమ్ బెటర్. సో ఒకప్పుడు కీమోథెరపీ తీసుకుంటే బాగా మాట్లాడచ్చు. ఇప్పుడు హార్డ్లీ ఇన్ ది లాస్ట్ 10 years ఐ హ్యావ్ హార్డ్లీ అవుట్ ఆఫ్ 1000 patients who receive chemotherapy, probably 1 or 2 might require admission because వాళ్ళకి వామిటింగ్స్ కంట్రోల్ కాదు. మెజారిటీ ఆఫ్ దెమ్ ఎవ్రీథింగ్ గెట్స్ కంట్రోల్. అండ్ వాటిని మనం డ్రగ్ సైడ్ ఎఫెక్ట్స్ కాకుండా డోస్ మాడిఫికేషన్స్ తోటి వీటితో మనం కంట్రోల్ చేసుకోవచ్చు. సో ఇన్ మై పర్సనల్ ఎక్స్పీరియన్స్, ప్రాబబ్లీ chemotherapy I have given to the oldest patient I have given chemotherapy is 92 years. That gentleman died last month. He had a very aggressive form of blood cancer, multiple myeloma. So last year they said that we just want him peaceful. Then I also said I also want him to go peacefully, but the only thing is you think the disease will not trouble you. జబ్బు మూలంగా వస్తుండదు, ట్రీట్మెంట్ మూలంగానే వస్తుందని ఒక మిస్కన్సెప్షన్ ఉంటుంది. నా పర్పస్ ఆఫ్ ట్రీట్మెంట్ కూడా ఆయన సఫరింగ్ తగ్గించడానికి వెరీ స్మాల్ డోసెస్ ఆఫ్ కీమోథెరపీ. He lived for 1 year. So what happened in his life for 1 year? He could see his granddaughter's marriage. He could see other granddaughters' kids. He could meet all his kids and he could give a very good report. So it is not always about curing. It is also giving, having a closure in your life when you tell, when you see all your loved ones. That 1 year was precious to that. Next year. Cancer cannot be cured in advanced age. So this is again doesn't apply to all cancers. So certain cancers, lymphoma antaru, germ cell tumors, in stage 1 ayina cure, stage 4 ayina cure. Even stage 4 lymphoma can be cured only with chemo. So, and always it is not about cure, it is always about quality of life. So when I was recently talking to our CTBS surgeon, he says that CABG, bypass surgery, commonly, it is the best palliative treatment. ఎందుకంటే palliative క్యూర్ చేయట్లేదు అని ఎందుకంటే జబ్బుని నయం చేయట్లేదు. ఆ ఆర్టరీ మొత్తం బ్లాక్ అయిపోతుంది. రక్తనాళాలు ఏదైతే ఆర్టరీ బ్లడ్ టు ది హార్ట్ అది బ్లాక్ అవుతుంది. దానికి వేరే దారి. ఆ బ్లాక్ ఏర్పడడానికి ఏదైతే జబ్బు ఉందో, హై కొలెస్ట్రాల్, డయాబెటీస్, స్మోకింగ్, ఒబిసిటీ, ఇవన్నీ యు ఆర్ నాట్ క్యూరింగ్ ఇట్. You are just palliating. The palliation. It is all about quality of life. So it's not only about cure, it is about quality of life. It is also prolonging life. Like I said, for that elderly man of 91 years, that 1 year was important so that he had certain things in his mind to do, and he could do that. And certain cancers, like I said, germ cell tumors, lymphomas, or oncological malignancies can be cured in any stage. But the most important thing is some of them can also recover very quickly. Not some of they can be controlled. It can be controlled. So, like I said, it's not always about, it's always about quality of life and living prolongingly. And the most important statement I make for everyone is, the uncertainties in everyone's life is same. The only thing certain in a cancer patient's life is the uncertainty. That's it. And that is there. The only thing the cancer patient is more aware of that uncertainty. Other people are not aware of that uncertainty. That awareness that I am having an uncertain life is what makes a cancer patient think more, worry more, fear more. But everyone's life is filled with equal uncertainty. So the risk of dying by walking on road is 1%. So we don't know that day if we are in that 1%. So uncertainty is there in everyone's life. So we should not worry about the uncertainty. We should solve this about quality. It is unknown fear. People. Again, like I said, age is the risk factor, but the outcomes are more. They do much better. Next slide. So biopsy can worsen cancer. This is a very practical problem. Sir, biopsy చేసినప్పుడు నుంచి గడ్డ బాగా పెరిగిందండి. So it doesn't happen. But without the biopsy, you will not even tell whether it is cancer and it doesn't. Then Ayurvedic medicine. I will not use Ayurvedic, but I think it's alternative medicine. Is safe and can cure cancer. So here there is a huge discussion. So for information, all the chemotherapy drugs are extracted from plants, bacteria and fungi. They are all naturally occurring drugs. Chemotherapy is the purified form of all these extracts. So we are not, chemotherapy is not something which is made in the labs by chemicals. Most common chemotherapy drug is paclitaxel. It was discovered and extracted from U plant. YEW, U plant. U plant ఎక్కడ పెరుగుతుంది? హిమాలయాస్ or in all mountain places. ఇప్పుడు ప్రపంచంలో ఇంతమంది క్యాన్సర్ పేషెంట్స్ కి ఇచ్చే డబ్బల్ మెడిసిన్ things. There are a lot of active drugs in it. We don't know which one will work. The second big problem is the interaction with the existing current drugs. No one knows. So when we are giving a cocktail of drugs, we don't know the adverse events. And మనం చాలా సార్లు వచ్చే వాదన ఏంటంటే సార్ ఆయన ఎవరో వాడారు తగ్గింది. So that is completely, that statements come because of the completely unawareness of how research is done. So ఒక్క మ్యాచ్ ఇండియా గెలిచింది కాదు వరల్డ్ కప్ గెలిచిందని ఎట్లయితే అనుకోవద్దు, ఒక్కళ్ళకి తగ్గిందని మిగిలిన వాళ్ళకి కూడా అదే నమ్ముతూ తగ్గుతుందని అంటారు. సో క్యాన్సర్ ఇంత 200 టైప్స్ ఆఫ్ క్యాన్సర్స్ ఉన్నప్పుడు ఒక్కొక్క డిఫరెంట్ గా బిహేవ్ చేసినప్పుడు how can the cure be only one drug or one form of treatment? That will not be there. So that is a big. What I say is follow science. Science has its own flaws, but that is the better way to do it. And alternative medicine might sometimes add limit to it, or when all your traditional forms of medicines have failed. That is when there one has to think of alternative form of medicine. Otherwise, in the current era, never it should be the first option. చాలా సార్లు మన దేశంలో ఫస్ట్ స్టేజ్ లో వచ్చి డయాగ్నోస్ అయ్యి ఆల్టర్నేటివ్ ట్రీట్మెంట్ తీసుకుని థర్డ్ స్టేజ్ లో ఫోర్త్ స్టేజ్ లో వచ్చిన చాలా మంది ఉన్నారు. Especially and this is not common among uneducated or illiterate people. It is also common among educated and highly literate people. So that is very important. Effectiveness is more important. How many patients get treated, and certain cancers even without treatment they do well and they can get cured also. That's very important. Positive attitude can cure the cancer. Sometimes mind over the matter. That is also very important. Positive mind, in someone's mind we don't know what are the chemical changes the body will. Probably that is what immunotherapy also does. That's very important. Next slide. No one is immune to cancer. It is a disease which does not discriminate between the rich and powerful. So we have a lot of famous celebrities getting cancer, and some people, most the world's richest people like Steve Jobs, the powerful people like Mr. So all the celebrities, most of them, they get cancer. But again, they are aware. So cancer can be cured if it is detected early, if it is diagnosed properly. So most important is diagnosis and biopsy. Very important. We have 200 types of, more than 200 types of cancers. So we need to know what is the kind of cancer it is to have the best treatment plan. Next slide. So if treated optimally. So here is what I suggest where lot of cases a lot of patients have bad news. Cancer is not decided by one person. It's always a teamwork, especially solid tumors. So we have tumor boards. where there is surgical oncologist, radiation oncologist, medical oncologist sit together, decide the treatment plan, and so tumor boards is a standard across the best cancer centers. So we here at our hospital, we also do tumor boards. We have so any lump, painless lump, very important. Dimpling of skin, very important. Any discharge or any swelling in armpit for all women. Self-breast examination is a must every 3 months for all women after the age of 4 months. Any swelling, just consult your gynecologist or an oncologist to see. Next slide. So, breast self-examination, clinical breast examination by doctor, and mammogram. Now, after the age of 40 years, next slide, we have a test called mammography, which is a specialized form of X-ray. This, after this so much amount of awareness stuff, I request all the women in your house after the age of 40, get a yearly mammogram once, at least once a year, a mammogram should be done, or at least once in 2 years, because it will detect the earliest breast cancer. So, even for a breast lump to be palpable, it should be 2 centimeters. So even for a 2 centimeter tumor, most of them require chemo. So to be detected when it is less than a centimeter, mammogram is the best. Now we have it in all diagnostic centers. So it is a simple test. So screening is recommended for all women above the age of 40. Next one. For cervical cancer, the screening starts at 30 years. And most important is unusual bleeding, intermenstrual bleeding, post-menopausal bleeding, post-coital bleeding. So any form of unusual bleeding, one should check for cervical cancer. And the screening starts at the age of 30 years. Once in 3 years, a simple pap smear by your gynecologist. So every woman should visit a gynecologist at least once in 3 years. Get a pap smear done to screen for cervical. And now young girls from the age of 9 to 26 years can get cervical cancer vaccination against the HPV virus. So that prevents the cervical cancer by almost more than 90%. Next. So very important. Other thing is good hygiene, regular screening, vaccination, spacing between pregnancies. All these are also important for prevention of cervical cancer. Next one. Tobacco related cancers. Again, like I said, the statistics are huge, and I don't know why it's still not banned. There is a lot of promotion, probably it's the tax revenue. So you have a lot of mainstream movie stars promoting that. Unfortunately, even though there is a very beautiful government tobacco control program, no one even talks. Next one. So if you see the percentage of tobacco smokers in India, it's just next to China. So we have huge burden of tobacco related cancers in India. Almost 40% of all cancers are caused by tobacco in India. Next one. So if you see how did it start, this was a study done in 2004. So almost 1/4 of the men use tobacco, and this was in the youth age 13 to 15 years. See the statistics, how dangerous it is. Ever tobacco use is 25%, current tobacco use is almost 17%, smokeless tobacco is 25%, Gutta, Pan, Aini, Zarda. So this means that tobacco is accessible even to a child in our country. That is where the community should fight. That not having access to a tobacco in the school areas, in the residential areas is very important. All the shops near your colonies should not be selling oral tobacco because that is where the kids get. Next one. So almost a lakh young people around the world become addicted to tobacco, and 90% by the age of 21. So below 11 years, hardly any users. 15 years, by the time they 15, 1/4 have addiction, and by the age of 21, 75% have addiction. So addiction is different, smoking is different. Lot of people just smoke once in a while, once a month, when there is a gathering. Addiction is that they have symptoms if they don't smoke. Next one. Lot of cancers can be caused by smoking. So I will not read out. So there are convincing data to tell that smoking causes a lot of cancers. Next one. So these are the important danger signs. Any sore throat, ulcer, lump in the neck, change in voice, difficulty in opening mouth, persistent cough. Any cough more than 2 weeks should be well. Difficulty in swallowing. All these are important signs which should never be neglected. Should be evaluated immediately. చెక్ చేసుకుంటాను అంటే ఇవన్నీ ఉంటే క్యాన్సర్ ఉన్నట్టు కాదు కానీ ఇవన్నీ అర్లీ. సో వీటిని వీటి కారణం చాలా దగ్గుకి 100 కారణాలు ఉంటాయి కానీ 2 వారాల నుంచి దగ్గు ఉంది అంటే ఖచ్చితంగా టెస్ట్. సో ప్రైమరీ ప్రివెన్షన్ ఈస్ హెల్త్ ఎడ్యుకేషన్, డి అడిక్షన్, గవర్నమెంట్ మెజర్స్ లాస్. సెకండరీ ప్రివెన్షన్ ఈస్ ది స్క్రీనింగ్. నెక్స్ట్, సో like I said, tobacco, self-oral examination and treatment. ముందుగానే చిన్న చిన్న తెల్ల మచ్చలు ఇవి వస్తే వాటిని ట్రీట్ చేస్తే అది క్యాన్సర్ కింద మారకుండా ఉండే అవకాశం ఉంది. నెక్స్ట్, so we have lot, like I said, never judge a smoker. We have lot of things they need to be dealt in the way they should be. They need professional help. We have professionals to help them, so we should seek professional help to quit tobacco. Next, so what is ఏం చేస్తే బాగుంటుందని నేను చెప్తున్నాను. Again, all these will not make you prevent cancer completely, but it will help you lead a healthy life and to tolerate any cancer treatment. So have the red meat once a month, the other the animal protein is weekly, and daily have good amount of whole grains, fruits, vegetables and oil, and avoid all your fast food. Next step. So exercise is the closest thing we will ever get to the miracle pill that everyone is seeking. So everyone, the recommendation is every person, అంటే మీరు రోజువారీ చేసే పనులు కాకుండా ఒక 30 minutes of walking at least in 5 out of 7 days చేయండి. That is the recommended physical activity for everyone. So with that, lot of your lifestyle diseases will be controlled. Next thing. So the take-home message is cancer is treatable, preventable, can be cured, but the best weapon is always knowing about it, being aware of it. Next thing. So I express my gratitude to all my patients who have been my teachers, and I'm grateful to their trust. Thank you.
Cancer. There are a lot of ladies where ladies are getting this cancer, particularly ladies.
So breast cancer, 5 to 10% are hereditary. The rest of the 90 is the age. As the age increases, the risk of breast cancer increases. The other risk factors for breast cancer: late age at marriage, lack of breastfeeding, fewer pregnancies or no kids. All these are risk factors. Early menarche, late menopause. So when they are exposed to more estrogens, they develop that risk of breast cancer. Even without that, age, after the age of 60, 65, the risk of breast cancer. So every cancer has different causes. And most importantly, obesity. That is the effect in obesity. So we have gyms to lose weight and maids to go on daily.
Why is obesity as a
So obesity is increased, high sugar stuff, high cholesterol stuff. So that's why we are gaining weight. ఇప్పుడు అంటే చిన్నతనంలో మీరు అందరూ కూడా పండగలప్పుడే స్వీట్ చేసేవారు. It was only during festivals sweet was. Now you want to have a sweet, you can have 3 times a day, daily. It's available. Food available. మన రాష్ట్రంలోనే when that 2 rupee kg rice was started, the number of diabetics actually increased. No one talks about it, but the health data says that once food availability. So what is quality of food you are? You have to eat more whole grains, not refined rice or meat. You have to eat more whole grains. Unfortunately, we forgot that. We discarded them. Again, now they are coming with meats.
internationally renowned oncologist, Dr. Gaju from Sapporo University said, plant-based food is best to prevent cancer. When she says plant-based food, doesn't mean that we should avoid dairy milk because it's not plant-based. Is it possible to follow that? What is plant-based?
After the plant-based food is, the quality of protein you get in plant-based food is not so good. Not so good. Or not so, the integration is not good. Okay. So what we call it as a biological equivalent, if you see that is highest for egg white, followed by plant protein, then all the not. So now we know for sure, especially in patients with cancer, shifting to a plant-based diet actually improves their tolerance to treatment. Now the worldwide thing is going for a more plant-based diet, because plant-based diet has more antioxidants, so more healing capacity, so more ability to remove toxins. So we don't know what causes the genetic event and increase in the uncontrolled cell growth. You know, so some environmental factor must be doing a pollution or a diet or something. So when you take plant-based diet, again daily it's not it's not completely about daily. It's about keeping it in moderate. It's all about moderate. In general, in life, it's all about moderate.
Don't do extremities.
Yes.
Doctor, correlate that to immune food
पूछिए
नहीं इन्हें पूछा उसकी का बात बोला that follow the
no problem जरा बताइए कौन सी बात
बोलेगा times
स्वीट हाँ मैंने
I thought it is some veg.
Thank you.
अभी फूड अवेलेबिलिटी बढ़ गया एक जमाने में जब घर में त्योहार होता था तभी तो मिठाई बनता था अभी ऐसा है आपको दिन में 3 बार भी मिठाई खाना है 4 बार भी मिठाई खाना है तो आपको मिल जाएगा रेडीमेड नहीं तो मिठाई बनाने के लिए भी काफी प्रोसेस होता है काफी मेहनत लगता है सब्जी बनाने से ज्यादा मिठाई बनाने में ज्यादा मेहनत लगता है मिठाई बहुत ज्यादा इजीली अवेलेबल हो ऐसा फूड अवेलेबिलिटी So hepatological cancer का मतलब है ब्लड कैंसर तो ब्लड कैंसर सिर्फ दवाइयों से ही कम होता है लिम्फोमास और आल्सो अ काइंड ऑफ ब्लड कैंसर लिम्फोमा में क्या होता है गांठें बन जाती हैं
Sir, maximum be about 16 days prostate cancer.
So prostate cancer so main prostate cancer ఏంటంటే రెగ్యులర్ గా చేసిన హెల్త్ చెకప్ లో పిహెచ్ఐ ఒక సింగిల్ టెస్ట్ చేస్తాం చెకప్ చేయండి అది కాకుండా మెయిన్ గా యూరిన్ వెళ్ళడానికి ఇబ్బందిగా యూరిన్ వెళ్ళాక ఇంకా కంప్లీట్ గా వెళ్ళలేదని నాకు రాత్రి పూట నార్మల్ గా రాత్రి పూట లేచి వెళ్ళాల్సిన అవసరం లేకుండా రాత్రి పూట కూడా లేచి యూరిన్ వెళ్ళాల్సిన అవసరం లేదు లేకపోతే రాత్రి పూట ఒకసారి లేవాల్సిన వాడు 4-5 సార్లు లేస్తాను और మాటిమాటికి యూరిన్ ఇన్ఫెక్షన్ వస్తుంది మా బాడీ those are signs
You understand prostate?
back pain వచ్చిందంటే daily
It is a health, I don't know whether it is a myth or a fact. Those who are already set up cancer, they take whatever. It will kill the positive cells also in the body, is it correct?
So what happens is, you asked a very important question. For the lack of time, I didn't cover that. So chemotherapy is like a carpet bomb. So in a war area, you are taking the terrorist, even some civilian lines are crossed. Chemotherapy is like that. So targeted therapy or immunotherapy is like a guided research. You are pinpointing which cell to target.
Not in the answer chemotherapy.
That's not it. It's just like target one. So there will be some civilian casualty. That is why the dose matters. So you don't go beyond the dose where the collateral damage is more.
It's not like the situation.
प्रश्न है
Which is
ये जैसा प्रोटीन और कैल्शियम इसके पीछे कैंसर के कीटाणु छुपे रहते हैं करके मैंने पढ़ा है कहाँ तक ये बात सच है ये मुझे पता नहीं है
ये सच
बात है उसका ये है कि मुझे एक डॉक्टर ने बताया था कि लाइफोमा में जो है वो कैंसर उसमें डेवलप नहीं होता है उसके ऊपर कुछ पता नहीं
तो लाइकोमा मतलब फैट का ही abnormal इश्यू है उसमें कैंसर बनने का चांस लेस देन 1%. काफी लोगों को लाइकोमा करके रहता है हम तेलुगु में इसको बोकुगड्डल बोलते हैं लोगों के काफी लोगों को रहता है तो जिसको भी लाइकोमा है हम दो ये सारे गड्ढे कैंसर की कैसे कुछ गड्ढे होते हैं जिनको हमें डेफिनेटली टेस्ट कराना वो कौन क्या जब वो बहुत हार्ड हो जाता है और जब वो स्किन वहां पे ऊपर स्किन चेंजेस होती है बहुत लाल हो जाना काला हो जाना दर्द होना ये सारा चीज जब होता है तो गड्ढे उसको टेस्ट कराना बहुत जरूरी है तो जब तक वो सॉफ्ट है मोबाइल है आपको दिक्कत नहीं कर रहा है कम चांस है
मुझे ये बताया गया गोटी के पिंपले कीटाणु छुपे रहते हैं इसलिए उनको लोग पकड़ नहीं पाते हैं हमारे जो ब्लड सेल्स
वैसा नहीं
लेकिन मेरे पास करती
అంటే the most importantly like I said this symptom we have to look for prostate cancer but there will be other prostate problems which will cause benign age పెరుగుతున్న కొద్దీ prostate gland size పెరుగుతుంది so benign prostatic hyperplasia BPH that is more common than prostate so if someone has this symptom when you get evaluated there is no cancer it will be BPH may not be
This is the last time
మనం చెప్పిన అన్ని symptoms కి cancer one of the reasons there will be 10 other reasons that's the importance of getting evaluated
what exactly happens? Immediate changes or medical changes or the same? What happens actually? Why?
so very normal cell converts into a cancer cell when there are certain genetic changes in that cell genetic changes in that particular cell not all the cells in the body in that particular cell say suppose lungs में कोई एक या दो सेल्स को जेनेटिक चेंजेस आए क्यों आए पोल्यूशन के कारण आ सकता है स्मोकिंग के कारण आ सकता है वो आने के बाद वो अनकंट्रोल्ड ग्रोथ जब हो जाता है some will die some will not
They will force them.
yes
What is free radical?
free radicals are technically see water formula in H2O. So there is one oxygen and two hydrogen. You remove one hydrogen, what it becomes? OH negative. So it has a tendency to attach to any chemical substance and change that substance. These are free radicals. These free radicals, because they are not bound to anything, they can cause that structural damage to the cell, be it DNA or the other parts in the cell. And this free radical injury, our body also has the capacity to repair free radical injury. That repair mechanisms are lost as we grow. That is the reason you need to be healthy for your repair mechanisms to be.
I think I tell you see this.
You can consult me, sir, but I'll just show you the path. I'll not.
And we want to work.
Definitely. Definitely.
Inside in non-infectious.
Yes.
But how it comes practical that hereditary?
So, in hereditary cancers, we get two sets of genes. One from father, one from mother. Now, there is one set of gene may defect in, say, repair mechanism, DNA के repair mechanism, एक set में खड़ा हो. So one set of genes is always passed from mother to child. Again, that will go to another next generation. But the other set of genes is normal. So function normal. Someone who inherits one defective gene and one normal gene, when that normal gene also gets affected because of the other factors, environmental factors. What we call is a two-hit cycle. The first hit happened because you got that defective gene. Second hit happens when you are because of the environment or anything. That's when someone develops cancer. Someone who has two sets of normal genes, even if one is hit, there is other one there. So chances of having two hits in the same individual again is very easy. That's why hereditary cancers in those clusters of cancer. Chemo prevention is use of certain drugs to prevent some cancers. Like in very high risk, some breast cancer patients, plus high risk for some hormone positive breast cancer patients, we use a drug called TAMS. So that is to prevent cancer. So there are very selective cases where we can use it, like the one I said. Lot of times you don't have the side effects. The other thing is aspirin. Aspirin has a protective effect for colonics, but not all. Protective effect for colonics. We don't have any hard evidence, so one cannot say don't use it or use it. We need evidence to say that.
Blood cancer treatment
So it depends on the type of blood cancer. There are again 40 types of blood cancer. Yes, some are curable, some are not curable. Some need treatment, some don't even need treatment. So Kadavadalo is a common blood cancer, chronic lymphocytic leukemia. Common. Is just a simple blood test for that white powder. That kind of blood cancer doesn't need treatment. It only needs treatment if someone has symptoms. And there are a lot of patients who are just on follow-up. So their life expectancy is not affected. They don't have any symptoms, so they don't need anything. So it is again depends on acute leukemia. Treatment is without treatment almost better. तो ऐसे कोई प्रिवेंटिव डाइट नहीं है, बट हम ये बोल सकते हैं कि कोई अच्छा डाइट लेता है तो 100 में 10 लोगों का आएगा, कोई खराब डाइट लेता है तो 100 में 20 या 30 लोगों में. तो वो अच्छा डाइट का मतलब क्या है? तो अच्छा डाइट का मतलब ये है कि आप ज्यादा प्लांट, वेजिटेबल्स, फ्रूट्स, डेली कट्स, होल ग्रेन्स ले, जिससे आपका वेट भी नहीं बढ़े. ये रेड मीट जो बोलते हैं, रेड मीट मतलब मीट, मटन भी वो सारा आप महीने में एक बार खाएं. जितना भी बाकी जो चिकन एंड फिश से मेक इट वीकली वंस. सो दैट दिस एंड प्रिवेंटिंग वेट. ज्यादा ओबेसिटी को कॉज करने वाला क्या है? ज्यादा शुगर, ज्यादा हाई ट्रांस फैट वाला. उसके साथ अगर आप ज्यादा हेवी ओबेसिटी नहीं को प्रिवेंट कर सकते हैं तो आपके काफी सारे कैंसर ऑटोमेटिकली.
It's always. Most lots of girls, children get very that eating pizza, burger, nonsense food. Our advice is
Not yet.
all parents have to encourage you in birthdays.
Like I said, again, it's the intentional lifestyle, the kind of life we are leading, which has all led to this. Which has all led to changing the past. Not more than chemicals, it's about the quality of food you have. You are taking high carbohydrate, high fat, high sugar diet. It's going to have its consequences. It's not only going to have consequences on your life, it's also going to have consequences on your mind. When you give a kid with high sugar stuff, chocolates and all these things, they get very hyperactive. It causes behavioral changes.
You will get the age of old age.
Everything will have to relate to it.
BS zero for ನಾವು ಕಲಿ ಹೇಳಿದಾಗ ಕ್ಯಾನ್ಸರ್ ಅನ್ಸುತ್ತೆ
అనుకోవడానికి లేదండి, అది జస్ట్ ఒక అనుమానం వరకు చెప్తుంది.
రైట్ సెమిస్టర్ మరి చేసి ఆఫీసర్
బయాప్సీలో
రైట్స్ వాళ్ళే చూసాడు నాకు
బయాప్సీలోనే నిర్ధారణ, బయాప్సీలోనే క్యాన్సర్ లాగా నిర్ధారణ. క్యాన్సర్ ఉంది అంటే సత్యం, లేదు అనుకుంటే స్పాన్సర్
ముందొచ్చా
లేదు మీరు ఇన్వాల్వ్ కావాలి బయాప్సీ నెక్స్ట్ వీక్ వస్తుంది.
Dr. Sainath, veteran doctor, will solve a movement, solve it.
No other points are there, you go for vote of thanks. If there are any points you want to ask, please ask. Otherwise you will go for vote of thanks. So in any case, you have to all of you have to be.
Everybody got a packet. That packet was there, you another. Now we go for next one.
You join vote of thanks next time.
Next, you go up.
క్యాన్సర్ అవేర్నెస్ ప్రోగ్రామ్ ఈ మహత్తర కార్యక్రమానికి సాయినాథ్ గారు, డాక్టర్ సాయినాథ్ గారు, ఇన్స్పెక్టర్ ఆఫ్ దిస్ బిజీ షెడ్యూల్ ఇక్కడికి వాళ్ళు రావడం అనేటువంటి చాలా మహత్తరం. అట్ ద సేమ్ టైం వీఆర్ వెరీ ప్రౌడ్ ఆఫ్ హిమ్ అండ్ హిస్ ఫాదర్ వెంకటేశ్వర గారు. మన కమ్యూనిటీ, మన సర్వే కమ్యూనిటీలో ఒక మాత్రమైనటువంటి గోల్డ్ బంగారం బిడ్డ మీ డిపార్ట్మెంట్ నుంచి పంపించడం మాత్రం చాలా 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 ధన్యవాదాలు. మీరు ఇక్కడికి రావడం మీ యొక్క ఈ వైనాడు ఈ కార్యక్రమానికి మా మనందరం నిర్వహిస్తున్నప్పుడు చేయడం చాలా చాలా ధన్యవాదాలు. అట్ ద సేమ్ టైం ఇందాక దారి వస్తున్నప్పుడు ముఖ్య అతిథి ఈనాటి ముఖ్య అతిథి మా మల్లిక్ సార్. శాస్త్రి గారు మీరు పెన్షనర్స్ భలే భలే కార్యక్రమాలు చేస్తున్నారు, చాలా యాక్టివ్గా ఉన్నారు, అందరూ కూడా భలే మంచి కార్యక్రమాలు చేస్తున్నారు చెప్పి వారికి అభినందనలు తెలియజేశారు. వారు కూడా ఆఫీసు పనిమంతులు ఉంటుంది, అవన్నీ కూడా అధిగమించి ఇక్కడికి ఈరోజు ఇక్కడికి రావడం మల్లిక్ సార్కి చాలా చాలా ధన్యవాదాలు సార్. అలాగే మా అధ్యక్షుడికి థ్యాంక్స్, మరి మళ్ళీ థ్యాంక్స్, మా కార్యదర్శి గారికి థ్యాంక్స్. ఎందుకు చెప్తామంటే ఈ కార్యక్రమం ఏర్పాటు చేసినందుకు మా అధ్యక్షుడి వారికి కార్యదర్శి గారికి ధన్యవాదాలు. ఆ తర్వాత మీ అందరికీ ధన్యవాదాలు. కారణం ఏంటంటే ఎంతో దూరం నుంచి ప్రతి ఒక్కరు ఆల్మోస్ట్ చాలా మంది అందరి దూరం వాడు ఈ ఏజ్లో ఇక్కడికి వచ్చి ఈ కార్యక్రమానికి అటెండ్ కావడం అనేటువంటిది చాలా చాలా ధన్యవాదాలు. అలాగే ముఖ్యంగా మా లేడీ మెంబర్స్ చాలా చాలా సంతోషం. సుశీల మేడం అందరూ కూడా మీ అందరూ కూడా పేరు పేరున ధన్యవాదాలు తెలుపుకుంటూ ఈనాటి కార్యక్రమాన్ని చెప్పండి. ఇన్ఛార్జ్ సముద్రాల గారికి ఇంకా మర్చిపోతే ఎవరైనా సరే పేరు పేరున ధన్యవాదాలు తెలుపుకుంటూ ఈ కార్యక్రమాన్ని ముగిస్తున్నాం. అవునా డాక్టర్ గారు మొదలు వారి ఇద్దరు విశేషం. నాన్నగారు వారి వెంకటేశ్వర గారు ఆవిడ వారి గురించి చెప్పాలి. బంగారు తండ్రి తిన్నారు, చాలా సంతోషంగా. ఏ ప్రౌడ్ ఆఫ్ యూ. థ్యాంక్స్.